If you struggle and struggle and struggle with CPAP,
Spring does not officially arrive for 11 days, but allergy season is already in full swing.
That's right. Just ask about a quarter of adults, 1 in 5 kids in the U.S., they all suffer with seasonal allergies.
We brought in Dr. Tanya Elliott. She's an allergist here at NYU. She's got what we need to know to manage the symptoms. Actually, there's a new study out, Doctor, by a group called Climate Central, showing that climate change is actually making allergy season earlier, longer, and worse. How does that work out? How does
this
that
is
cause?
a trend we've been seeing over the last couple of years, and we've had much more mild winters here. And when you do, you don't get the benefit of the frost, so you have a longer growing season. The second reason for this is above average precipitation. So you have more rainfall and an overall, on average, warmer weather. Perfect storm for allergy season to start sooner.
Some people do say that it may get colder again later. I feel like things are blooming all over the place. Is there a chance that we may be hitting allergies now? It may go back down again?
It typically doesn't happen that way, and it always feels like in March, like mid to late March, we get one more snowstorm, right?
Yeah.
But it really is the trend over time. And once the leaves start blooming and you start to see the flowers blooming, there's no going back. So it isn't just if we get one, cold day, then we, benefit from a frost. It's the train, the ship has sailed.
And, I've been saying all morning, if we're going to have spring allergies, could we have some spring temperatures?
We like that.
Which we do not have. This is the age-old question with allergies. Is it allergies or is it a cold?
Yeah.
What are the symptoms we're looking for? How can you tell the difference?
So itchy eyes, runny nose, congestion, facial pressure are consistent with allergies, but you also see that when you have a cold.
Yeah.
So 2 key things. Allergies never cause a fever, and they don't cause swollen lymph nodes.
Okay.
The second thing to remember is the timing and duration of your symptoms. So if you're allergic to springtime pollen or tree pollen, you're going to have symptoms for a few weeks or even a month. With a cold, typically your symptoms last 7 to 10 days and then they're gone.
Should you I always wondered this with my daughter too, should you test them for allergies? Like I noticed they're itchy and all this sort of stuff, like to find out what it is they're allergic to?
That's the most important thing to do is figure out what you're allergic to, and then you can avoid those triggers. So it's really important to correlate the timing of your symptoms. So if you're having itchy eyes and runny nose this time of year and into the spring, you should be tested for tree pollen allergy.
Okay.
If you have symptoms in the summertime or the late fall, then it's grass pollen allergy or weed and ragweed pollen allergy. So it's a combination of testing as well as your history of when you're developing the symptoms.
But the remedy's still the same regardless of what kind of pollen it is, right? What should you do if you have those?
Yep. So if it's an outdoor allergen like pollen, you want to keep the windows closed and the air conditioning on in your home as well as in your car. I also recommend to patients just put a laundry basket right at your front door. Don't wear your shoes in the house. Take them off. Take all of your clothes. Throw them in the laundry basket. Wash them regularly, because otherwise you're going to track all that pollen into your house.
Right.
The other thing is try to avoid using hairspray, because pollen loves to stick to our hair, and then we just track it right into our house.
A couple of helmet heads here. Yeah, not happening.
Wear a nice hat, too, in the spring.
Well, okay, so if it's starting earlier, let's leave on a good note. Will it end earlier?
I wish I could say yes.
Oh, come on.
It lasts longer, so we're not in the clear until the first frost.
Really?
Next year?
Next year.
Goodness. All right.
Wow.
Well,
All right,
Dr. Elliott. No hairspray, allergy.
Life. Do you feel embarrassed? Isolated? Tired of having to constantly reassure others that you're not sick? Have you managed your symptoms with medications and sprays only to have them return? If this all sounds familiar, you may be suffering from chronic rhinitis, a common condition that affects over 30 million people in the U.S. alone. Chronic rhinitis occurs when abnormal nerve signals in the nasal cavity cause inflammation and excessive mucus production, leading to a persistent runny nose, postnasal drip, congestion, coughing, itching, and sneezing. Luckily, there's now a non-invasive treatment for chronic rhinitis that can be performed right in your doctor's office with minimal discomfort. The Rynair procedure from Aran Medical uses temperature-controlled energy to disrupt those abnormal signals and offer you long-lasting relief with zero downtime. That lasting relief means an improved quality of life and a significantly reduced need for tissues and expensive over-the-counter medications. In fact, a recent survey showed that 96% of Rynair patients experience substantial relief from their chronic rhinitis symptoms. So don't let a runny nose run your life. Ask your doctor if the Rynair procedure from Aran Medical is right for you.
Vivair is an innovative way to provide your patients with lasting relief from nasal airway obstruction by treating and remodeling all three components of the nasal valve without precluding the possibility of a future nasal surgery. Using temperature-controlled radiofrequency energy, Vivair treats nasal airway obstruction and nasal valve collapse to significantly increase airflow by increasing the radius at the most narrow part of the internal nasal valve. In contrast to alternative treatments, such as surgical intervention, the Vivair procedure is non-invasive, incisionless, and office-friendly. To perform the procedure, apply gel to the tip of the Vivair stylus and insert to treat the caudal edge of the upper lateral cartilage. Apply pressure anterior to the nasal bone and maintain a 4 mm lateral deflection, or about the width of a stylus head. Initiate the 30-second treatment cycle by holding the foot pedal and maintaining lateral deflection. You'll hear the console beep twice after 18 seconds of heating, and again after 12 seconds of cooling. Continue along the treatment zone of the upper lateral cartilage, being careful not to overlap treatments. Apply treatment if needed to the inferior turbinate and septal swell body, applying mild pressure to the head of the inferior turbinate to treat hypertrophy, and to the septal swell bodies along the anterior portion of the septum. After being treated with Vivair, patients reported significant improvement in nasal breathing, sleep quality, and other quality of life measures through 2 years post-treatment. Connect with us today to learn how to bring Vivair into your practice.
Starts, and VR, who had his 9-game hitting streak ended last night, gets the hit. He's going to try to go for a 2, and he is out as Phillips tagged him between the legs, really without even looking.
Chu gets it in quickly. VR's trying to take the back, and there's Brandon just kind of sticking the glove out there.
You guys have heart too. Watch this. Josh Reddick, cool dude. Used to kick the ball right on. Hey, my night is made. So here comes a bad cop. Yeah, look at the smile, right? Now he's going to ruin the night. Are you kidding me? just playing with the kid. And then the kid offers him a fist pound. How great was that?
He's leaving men on base who are scoring later. She would know.
I don't know my dances. I'm not going to try to say I do, but I'm not familiar with some of that.
You got this motion?
Okay, good. That's it. That's
And she had this going?
Yeah.
I need to find her.
Well, if you didn't have the mic, you could really do the whole thing.
You're right. Little sunflower seed shower. Thank you guys for this. Good luck or something. They've had some tough games here against the Texas Rangers recently, but that hasn't been the story against the Oakland A's today.
Back here at the Trop in St. Petersburg, Florida, the Astros are in the mood for a victory today. The dancing routine is going on in the dugout. It is a throwback day to the 70s, and the Astros are sporting the rainbows once again. They had a big day in Seattle with the rainbows on. Certainly George Springer did. He had a couple of home runs wearing this uniform earlier in the year, and they'll try to duplicate that today. They'll have a new right-hander on the mound, Jake Buchanan, just called up, as Brad Peacock has been in Major League Baseball.
It's really forceful out there.
I think
The Rays lead the Orioles tonight 3-1. They're in the middle of the 7th inning. He's going to predict the sex of the baby now, as only an alien can do.
There's your first pitch and then some from Simone Biles.
Thank you very much for tweeting me at HoChenCSN, and let's check out this one right here. Oh man, there is the kiss. There it is. Guys, back to you.
The kiss. It will forever be known. Orbit is one very happy extraterrestrial being right now. Miss Texas is here and threw out the first pitch.
I think she might have thrown a complete game last night, because or might be hanging a little bit.
Well,
judging by the toss.
But try to throw in those shoes, though.
Well, oops, he's victimized by the age-old baseball trick, airhead. Foul by Dilson Herrera into the seats.
It's got to be that guy. I mean, you've got...
Are a series of interconnected hollow spaces in the skull. Their walls are lined with mucus-secreting membranes. Small hairs sweep the mucus out of the sinuses so it can drain out through your nose. These mucous membranes may become infected or inflamed because of a cold or allergies, and can swell up and block the nasal passages so that the fluid from the sinuses can't drain. Buildup of fluid in the sinuses causes pressure and pain. Doctors call this sinusitis. Acute sinusitis comes on quickly and then leaves. With chronic sinusitis, people have symptoms virtually all the time and take many courses of medications such as antibiotics to treat the inflammation. Severe sinusitis may require surgical opening of the passageways with rigid steel instruments placed up through the nostril to remove bone and tissue blocking the drainage. Recently, a new less invasive technology called balloon sinuplasty has been introduced. Using this technology, a balloon catheter is delivered to the blocked passageway and is gently inflated, widening the opening of the passageway and thus allowing drainage and relief from the pain and pressure.
A good night's sleep doesn't just help you feel rejuvenated and ready for a new day. Getting a proper amount of deep, restful sleep is vital to your overall health and well-being. Making some simple but important changes to your sleep and bedtime patterns can improve the quality and duration of your sleep. Consider these tips for getting a better night's sleep. Make sure that your bedroom is cool, dark, and quiet, and that your pillows in bed are comfortable and free of clutter. Try to go to bed at the same time every night so you can create a relaxing routine that helps your body know when it's time to rest. Sleeping for roughly the same number of hours every night promotes a healthy, repeatable sleep cycle. 7 to 8 hours of sleep per night are recommended for most adults. Limit the use of electronic devices such as televisions, cell phones, computers, laptops, and tablets before bed, or leave them out of your bedroom altogether if possible. Blue light from these devices fools the brain into thinking it's daytime and inhibits the production of melatonin, a sleep hormone. Try not to eat too much late at night. Heavy, rich, fried, and fatty food eaten late at night can lead to acid reflux and interrupt your sleep. Limit stimulants, sugar, and caffeinated beverages. Alcohol should only be consumed in moderation. While alcohol may induce sleep, it can also disrupt your sleep later in the night. Limit daytime napping to 30 minutes or less. Healthy exercise approved by your physician may also benefit the quality of your sleep. If you have taken steps to improve your sleep but you haven't seen positive results, your sleep problem may be more complicated. An ENT, ear, nose, and throat, or sleep specialist can discuss additional tests and treatments for more complex sleep disorders, as well as which options might be best for you. For more information on sleep and snoring conditions, visit www.enthealth.com.
This morning on today's checklist, some relief for springtime allergies. NBC News medical contributor Dr. Natalie Azar is here to walk us through some of the best treatments, some of the best solutions so we can enjoy the weather without the side effects. Dr. Natalie, good morning. Full disclosure, as you know, long-time allergy sufferer. Yeah. I've tried every product up here, including the shots that we'll talk about in just a moment. But let's start with antihistamines.
Yes.
When do you use antihistamines?
So the general recommendation, well, first of all, they're to be used every day. So these are what are called every day.
In allergy season and outside allergy
So you're
season.
supposed to start them if you know that you're going to start, if you're an allergy sufferer, even if you start like even a few days or a few weeks before allergies start to hit, you're better off. And you really want to do it it's a 24-hour pill. You want to do it every day. You don't want to wait until you become symptomatic and then you take the pill and then you hope it's going to work. Mm-hmm. And it's something that you do need to do on a daily basis. And I don't know about you guys, but we were talking about how some things don't work.
Yeah.
So I reached out to one of my allergy colleagues and I said, it's once a day. Can you take it more often? And the rule of thumb is that you can probably take these actually twice a day, but always check with your doctor because there can be some drug interactions. Also check the age of your children in terms of when you can take these. For example, like Allegra has different dosing recommendations than Zyrtec and Claritin. And also check with your doctor if you're pregnant.
You mentioned Zyrtec. This one was just named best over the counter
by Pharmacy Times.
Okay.
Yeah, and for good reason.
Why?
Yeah, it works.
Because it works. Not for you, but it works for everybody else.
All right. So you have allergy medicine, but then you also have just a decongestant when you're super stuffy.
So actually, allergists don't recommend decongestants, either nasal or oral decongestants. Like I know we've all used once in a while, but it's really not recommended for that allergic rhinitis for chronic use at all. What they do recommend, on the other hand, are intranasal steroids. So that is a steroid that's delivered directly into the nasal passages. And we like things in medicine, we like things to go where they're supposed to be, rather than taking a steroid, for example, by pill. But it's very important to follow the directions carefully. One of the it's not common, but a complication of intranasal steroid can actually be a problem with that septum in the middle of the nose. It could perforate technically if you use it incorrectly. So you definitely have to use it appropriately. You're supposed to sort of direct it to the outside here, not use it to the middle.
And it's tempting to use it probably more often than you need to.
Well,
let it
here's
work,
the thing.
Right?
It really does need to be used. It can be used regularly. If you develop nosebleeds, for example, you definitely need to discontinue. And then I added this here too. This is an antihistamine nasal spray, which can also be used. This is by prescription only. These are over the counter.
Okay.
My little guy last night was like, "Mommy, can I just use another Zyrtec?" Like he's just so miserable.
So ask the pediatrician,
it's tough.
right, about dosing more than once a day because they really are meant to be taken once a day.
But here's the thing: I haven't tried some of these other things.
Yes.
That was why I brought it up. So
have you done the neti pot?
I've done the neti pot.
I'm surprised it's not filled with
you.
water, so we could have you try it.
I know.
Yuck.
So this, I think, this is. I've never done it because I don't know.
It's just gross, but it works, right?
Yeah, people get afraid of this idea that they're going to feel like they're drowning. So if you watch a video, it's very important that you take it a certain way.
You take it here. I'll just say you do it like this. You pour it in one. I've never done it
in one nostril,
and then it comes out the
other nostril.
You have to use certain water, right?
Right, and that is the most. No, you can't. If you boil tap water and let it cool, it has to boil for at least 3 to 5 minutes. But better than that is to get a distilled or sterile water from the drugstore, and then you mix it with the saline packet, and that's how you can use it safely.
Okay, we only have a minute left.
And this I just added here too. This is just a nasal mist. This is saline.
Does that work?
This helps to just keep the membranes moist.
Can I do that to them when they? Yes. My sons get nosebleeds. I mean, it's
because it keeps it nice and moist, but it's not going to flush out the pollen and everything the way the neti pot does. Okay, and then finally a HEPA filter. We became comfortable with this term right during the COVID pandemic. But if you have a HEPA filter at home, that can also help to filter out all of the pollens and pollutants. And then some other things that we always recommend for allergies, folks, is to check your air quality. If you know it's going to be a bad pollen day, you definitely want to make sure that you're taking your Claritin or Allegra. You want to minimize opening doors and windows, even though we love that fresh air with screens. Avoid outdoor activity in the morning. That's when pollen is highest. Take your clothes off, shower when you come inside, and then our HEPA filter as we
do all of the things.
Great advice.
Yep.
Great advice.
And if it doesn't work, call Craig.
Yes.
Exactly.
We didn't even get to the shots.
Misery loves company.
Oh, if it doesn't work, you call your allergist, and you absolutely can do allergy shots. It can take it's a couple of year commitment, but it absolutely can work.
That's why I stopped.
Okay. Dr. Natalie, thank you so much.
After years of declining hearing, 75-year-old Satya Kara is getting his first hearing aid.
How's that feel? Pretty good?
A device that studies show is not only good for his ears, but also his brain, and a potentially powerful weapon against Alzheimer's and dementia.
If you now find out that getting these hearing aids is preventing or delaying cognitive decline, how will that make you feel?
I wish I had got it earlier.
Research finds a clear link between hearing loss and dementia. While mild hearing loss doubles a person's risk, moderate loss triples it. And those with severe hearing impairment have 5 times the risk. Experts say that's because hearing loss causes the brain to work harder, hurting other functions like thinking and memory. Poor hearing also causes people to be less social and more isolated, and that can lead to brain shrinkage.
What I tell patients is that if you don't use it, you lose it theory. So if you're not getting verbal information to the brain and you're not using that language perception abilities, you may lose some of that function over time.
In fact, one commission on brain health calls hearing loss the #1 risk factor for dementia, contributing to nearly 1 out of 10 cases worldwide.
So are you advising people starting it used to be go get a mammogram at 40, get a cognitive checkup perhaps at 50? Are you saying include a hearing exam at every single physical?
You know, I have a very strong opinion on this because we check hearing in children in pediatric offices all the time. Right. And we check sight throughout people's lives. So it should be screened, I think, the way sight is screened. And it doesn't take very long, and it has a huge impact.
Now a new study shows just how large an impact treating hearing loss can have on the brain. Johns Hopkins researchers gave hearing aids to nearly 1,000 seniors with hearing loss, then measured their cognition over 3 years. They found for subjects at higher risk for dementia with conditions like type 2 diabetes and hypertension, using a hearing aid actually cut their cognitive decline by nearly 50%.
Hearing aid intervention, it basically allowed people to better hold on to their memory skills, better hold on to abilities to use language to name unfamiliar objects, as well as better overall rates of multitasking over time.
Still, only 1 in 7 people who need hearing aids actually get them.
What is the stigma? Is it that I'm old?
For some patients, definitely. So patients actually say to me, I don't want to be perceived as old.
Satya says he ordered one only after his doctor told him it could reduce his risk for dementia.
Is cognitive decline scarier to you than losing hearing?
Absolutely.
He says he wants to stay sharp as long as possible to enjoy his precious grandchildren. And anything that slows cognitive decline is worth it.
So you've been able to get away with saying to your wife, I don't hear you, and now you're not going to be able to get away with that anymore.
That's true. Yeah, that is true, yes.
It's funny. Experts recommend getting your hearing tested at least once a year, just like your vision. There are also some apps that you can download to test your hearing at home. They can give you a heads up if you need to see a specialist for more in-depth testing. Oh. And everybody says this study that just came out really has changed the game. People are calling up and saying, maybe I need a hearing aid. Wow. And I would actually, I don't mind not hearing, but I do not want to get dementia.
And they've made so many advances in hearing aids.
They have.
I can't even see one. Yeah. About small.
The Golden Bachelor has one.
Yeah, well, there you go. And you run them on an app. I mean, it's totally different. Yeah. We only have 30 seconds, but there's a big White House initiative. You were there on Monday. Tell us about it.
White House initiative, first one ever for women's health research. So it's a big milestone for women and for diseases that affect women. Only 10% of the federal budget goes to studying diseases that impact women. So I'm really hopeful, along with the First Lady, that we can get that up to at least 30% and eventually 50%. So it's a big thing for women.
It's groundbreaking. Yeah,
groundbreaking.
Wow.
Yes.
Maria on a mission. We love it.
On a mission.
sinuses are a series of interconnected hollow spaces in the skull. Their walls are lined with mucus-secreting membranes. Small hairs sweep the mucus out of the sinuses so it can drain out through your nose. These mucous membranes may become infected or inflamed because of a cold or allergies and can swell up and block the nasal passages so that the fluid from the sinuses can't drain. Buildup of fluid in the sinuses causes pressure and pain. Doctors call this sinusitis. Acute sinusitis comes on quickly and then leaves. With chronic sinusitis, people have symptoms virtually all the time and take many courses of medications such as antibiotics to treat the inflammation. Severe sinusitis may require surgical opening of the passageways with rigid steel instruments placed up through the nostril to remove bone and tissue blocking the drainage. Recently, a new less invasive technology called balloon sinuplasty has been introduced. Using this technology, a balloon catheter is delivered to the blocked passageway and is gently inflated, widening the opening of the passageway and thus allowing drainage and relief from the pain and pressure.